And now it's time for The Doctor Is In.
I'm Meredith Armstrong, and this is The Doctor Is In. Today we have with us Dr. Tyler McDonald from USA Health, and he is a pediatric orthopedic surgeon. And we are here to talk about adolescent idiopathic scoliosis. So scoliosis is a word that we have often heard, but tell us a little bit about what that means. You brought props, so I know you're ready.
Props, yes. Adolescent idiopathic scoliosis is a condition of the spine that often affects adolescent-aged children. Now, with this prop I have here, in a normal spine, it should be straight when you look at it from the front. But from the side, you do have these normal curves. So up top, in the upper spine or the thoracic spine, you have this bowing out, and we call that kyphosis. Down here in the lower spine, the lumbar spine, you have this scooping in, and that's called lordosis. So scoliosis just stems from a Greek word meaning like bent or curved. So scoliosis is just any curve greater than 10 degrees when looking at it from the front. Now there's many different types of scoliosis that can affect adolescent and pediatric age children, but by far the most common type is what we're talking about today, adolescent idiopathic scoliosis, or AIS for short, less of a tongue twister. It's about 7 times more common in girls than boys, and it can run in families. And it tends to present around age 10 to 11 and can progress pretty rapidly during the adolescent growth spurt.
So what are some signs and symptoms that parents need to be on the lookout for?
I would say the biggest thing that people ask about is back pain.
Okay.
But I think there's some common misconception there. So back pain is super common amongst adolescents, even without scoliosis. So the causative link between back pain and scoliosis is weak at best. Often the signs and symptoms of scoliosis are silent and can go unnoticed.
Okay.
You can have things such as waist asymmetry, one shoulder can be higher than the other, the trunk can be shifted to one side versus the other. But often these changes happen so slowly over such a long period of time that patients don't notice. It's like growing your hair out. You may say, hey, look, my hair is really long, but it's not like you're waking up every day, looking in the mirror, being like, hey, look how much longer my hair got since I went to bed. So it's the same thing with scoliosis, just over a much longer period of time.
Got it. We're going to dive into some of the treatment options that Dr. McDonald offers online. So join us there for more with Dr. McDonald from USA Health and to talk about adolescent scoliosis with our fun props. I'm Meredith Armstrong, and we will see you next week.